Welcome everyone. Thank you for joining us. My name is Joanna Pickles and I work on social protection for the Australian Department of Foreign Affairs and Trade. It's my pleasure to be the moderator for today's webinar on information systems for the social protection sector, social registries and beyond. Next slide, please. Today is momentous as we bring together the authors of two new reports. Kathy Lindert will present the World Bank's new report on this topic, and Valentina Barker will present a report by DFAT and Oxford Policy Management. Both reports represent many years of research and analysis, and they're deeply grounded in country experience. This is a topic which is important for all countries that invest in social protection. Social registries and beneficiary registries, and the way that they integrate with program management systems and other administrative data, create the critical information infrastructure that enables the right person to receive the right benefit at the right time and in the right place. And as we will hear today, there is now a broad and a deep range of country experience and variation in developing these systems from which we can all learn. But before I introduce our wonderful speakers, I want to take this opportunity to let you know that this webinar is the third on this topic that we have convened through socialprotection.org. For those of you who might be joining us for the first time, you can view previous webinars by joining our online community on social registries and integrated management information systems, which is on socialprotection.org. You will find there a comprehensive repository of literature, practical information, and over 120 other members who are interested in this topic too. If you're not already a member of the community, sign up and then you'll find out about future webinars. We have a few planned for the coming year. Next slide, please. Also, after today's two presentations, there will be time for questions and answers. You can submit a question at any time using the function on the GoToWebinar platform, and I encourage you to ask any and all of your burning questions. If we do not get a chance to ask them all directly today, they will be responded to in written form and placed on the online community over the next few weeks. And can we move to the slide with Kathy? It's my great pleasure now to introduce Kathy Lindert, who many of you will know. Kathy is one of a team of 5 in the World Bank who developed the report released earlier this year on social registries for social assistance and beyond, a guidance and an assessment tool. Kathy has worked for the World Bank for 25 years in Latin America, Europe and Central Asia, North Africa, as well as in global roles. She spent 5 years working at the World Bank's office in Brazil, where she managed the partnership with the program. She also served as sector manager for social protection for Europe and Central Asia, and she has authored papers on a really broad range of fascinating topics: safety nets, poverty, social spending, redistribution and transfers, the nuts and bolts of Brazil's Bolsa Familia program, political economy, social registries, the US welfare system, decentralized implementation of conditional cash transfers, and food subsidy. She has a PhD and a master's in economics from the University of California and in international economics from the American University in Paris. Following Kathy, Valentina Barker will draw out lessons from the DFAT report titled Integrating Data and Information Management for Social Protection, Social Registries and Integrated Beneficiary Registries, which she authored. This report builds on the DFAT 2014 paper, which she prepared with Richard Chichir, also on this topic. Valentina is a senior consultant at Oxford Policy Management's Poverty and Social Protection portfolio, and she focuses on how delivery systems can facilitate responsiveness and effectiveness in social protection systems. Her key area of interest in recent years has been integrated data and information management, but also digital identity and accountability mechanisms, as well as rigorous and user-focused M&E systems. She's applied all of this in the field of social protection, and she works on research as well as policy design across several countries. She is the author of the application Integrating Data and Information Management for Social Protection. So now that we've introduced full speakers, it's without further ado that I hand over to Kathy Linder. Could you please load her slides?
Hi everyone, good morning, good afternoon, and good evening, wherever you are. So this presentation is based on several years of work led by Felipe Leite, Tina George, Chang Ching Sung, Holly Jones, and myself, as well as a whole slew of World Bank staff. We have about nearly 200 people that work on delivery systems around the world, and many directly on these systems. So go ahead to the next slide. So as we all know, the poor and vulnerable face multiple constraints in their daily lives, reflecting the multiple dimensions of poverty. They face low earnings and economic circumstances, limited assets, low human capital, remoteness, shocks, crime and violence, family challenges, and even personal challenges. Next slide. Given these diverse constraints, many countries offer a myriad of programs, meaning benefits and services, to various groups along the life cycle. And we're really talking here about both benefits and services. A lot of people just get focused on the cash transfer aspect, and those can be important to help alleviate poverty, but it's very important for people to also receive a slew of other benefits. So in orange, we have all different kinds of benefits, in kind, in cash, but also services, which are the ones in blue along the life cycle: family services, services for at-risk youth, activation, training skills, so long-term care. Next slide, please. It's interesting because although those programs seem quite different, we found through a lot of work that most of these programs pass through very similar processes along what we call the delivery chain. This is probably sort of the anchor of all of the work we're talking about today, because we focus on function. All of these programs need some kind of outreach on the left to communicate and ensure that people are aware of program and potential eligibility. Moving towards the right, they usually all involve some sort of intake and registration to gather basic information about the people. They all usually carry out some form of assessment of applicants' needs and conditions to determine potential eligibility. So that's all the blue part on the diagram. Then these programs all need some kind of enrollment decision. Are people going to be in the program or not in the program? And then decisions about what kind of benefits and service package they might receive. That's the red part. And then you get to this purple part, which is this recurring implementation cycle for transactions, which would involve the delivery of the actual cash payments, if that's what we're talking about, or in-kind benefits and services. And then case management. So all these programs go through these phases along the delivery chain. Some programs might group some of these phases. Some of them might be more intense in certain phases and less intense in others, but pretty much almost all of these programs that are geared towards individuals and households will pass through these kinds of phases. The case management part is usually the part that is the most idiosyncratic or the most different across programs. So if you're talking about a cash transfer program, case management would mostly be things like updating, verification of information, recertification, and or closing a case, and grievance redress. If you're talking about a conditional cash transfer, you would add to that the monitoring of conditionalities like for education and health. But if you're operating services such as for at-risk youth, case management would be much more intensive, involving significant social worker involvement, intermediation, and counseling. Next slide. So what about the role of information systems, which is the topic of today's discussion, and certainly not the only part of a delivery system, but an important part. All along the delivery chain, information systems intermediate between citizens on the one hand and institutions on the other hand. And by citizens, we don't mean nationality, we just mean households and individuals, families, people. Informations flow between these actors all along the delivery chain. They support these information flows with multiple layers: the software applications layer, the database management layer, the hardware information technology layer. Next slide. So what are the kinds of components of information systems that support these functions? Because we always want to start our discussion and anchor everything that we're doing based on function. So that's why we keep returning to the delivery chain. Social registries support the part of the delivery chain that is in blue. They support these upstream processes of intake, registration, determination of eligibility, gathering information on all potential applicants. So if you're operating an information system to support these phases, you would be collecting information on all applicants, not just beneficiaries. And that's important for grievance redress and for other, if you offer this to many different kinds of services. The red part, it would be supported by beneficiary registries. That's the actual enrollment and setting of benefits package. So beneficiary registries would cover these decisions. They also might be gathering other information that would be needed to implement the program, as Valentina often talks about in her research, such as bank account information, which would be very important for shock responsive preparedness, in case you need to deposit cash in their bank accounts. School attendant, what's the school of attendance, health clinics, social workers that get assigned to their case, et cetera. So that's the beneficiary registry part. But mostly it's information about beneficiaries. You no longer would be keeping the information about those who are not in the program. Next slide. And finally, there's information systems that would support the implementation cycle along the delivery chain. There would be payment systems to support payments administration, oversight and controls, audits, et cetera, payroll. There would be case management systems. We just visited last week a integrated case here in a county in the United States to look at how they were integrating case management with the supporting of updating, monitoring of conditionalities, intermediation and counseling, progress towards achieving individual or family action goals, grievance redress, et cetera. And those systems, information systems, would often keep notes on the touch points that they have with the clients. Next slide. So now let's just zoom in on social registries for the moment. Social registries are both inclusion systems in terms of their function and information systems in terms of their operation. As inclusion systems, they support, as we just said, the processes of intake, registration, and determination of potential eligibility for one or more social programs. That's that whole blue part of the delivery chain. In terms of their operation, they are information systems, intermediating between citizens on the one hand and institutions on the other, with all those layers as we've talked about, software applications, database management, IT, and software. Thank you. Next slide. So what does that social registry gateway look like? One source of information for social registries that is collected for intake and registration is directly collected or self-reported. There are two broad methods for collecting self-reported information. En masse registration is the first type, which is usually carried out by teams of interviewers who go door to door on site. These are often called census sweeps, as they seek to gather information on virtually everyone living in a particular geographic zone, or maybe all rural areas, or even an entire country. Another type of direct collect or self-reported information is on-demand applications, whereby individuals and households would go to local offices to fill out an application form and participate in an interview, or they might even be completing those applications online through digital self-help windows. And many countries use a mix of these methods. Next slide. Focusing in on the first method for carrying out en masse registration, we've observed that there are diverse arrangements for carrying this out in different countries. Some countries have used contracted field teams. They're contracted specifically to carry out that task. Some use a mix of community workers and contracted field teams. Some outsource the function to firms or NGOs and let them manage the teams. Some, like Indonesia, have relied on the statistics office to carry out these census sweeps. Regardless of these institutional arrangements for data collection, there's important advantages and disadvantages of en masse data collection. The advantages of census sweep approaches is that they tend to be fairly comprehensive in capturing all data on all or most of the households in a given region at a single point in time. The disadvantages are that they can be quite costly to administer overall. And most importantly, they tend to be carried out infrequently, only every few years. which is quite a disadvantage. That means that they can be quite static, leading to increasing errors of inclusion and exclusion over time, which can be of concern. Next slide. We've also found that there are diverse arrangements for carrying out on-demand applications. Some countries use the deconcentrated offices that report to the central agency. Some countries operate through local government offices, such as municipal governments, usually with formal agreements and sometimes with performance-based administrative cost sharing. Some allow individuals to enter through any program. So you might apply for one program and that would get you consideration to all sorts of other programs. The no wrong door policy, like what we just saw in the county here in the US and in Mexico. Some countries like Pakistan are just trying out the on-demand approach. They're piloting with these temporary desks set up in areas with announcing on-demand calls with outreach and communications. Finally, some support on-demand applications online, and that's increasing, and we expect that to increase worldwide. And most of the developed countries actually use online self-help service windows. Regardless of these institutional arrangements, there's important advantages and disadvantages of on-demand systems. The big advantage is that they support a more dynamic and permanent system that can facilitate people to apply for benefits and services at any time, and thereby lower errors of inclusion and exclusion over time, as long as outreach is carried out to inform and bring in the marginalized groups. They also allow for some self-selection out of the system by wealthier segments of the population who don't apply because they're unlikely to need the benefits or services that are provided through the social registry anyway. Disadvantages are that they require a large network of citizen interface, and what's usually blocking countries from moving to an on-demand approach is that they might not have that network around the country of these offices and social workers to operate on demand all the time, all year round. Next slide. In addition to the diversity in arrangements in the local data collection, intake and registration level, we also find diverse arrangements for managing and operating the information of social registries. So there's the information systems management. Some countries manage and operate those systems through a central agency. Some of them manage them through a central agency, but they have an operating agent, like in Brazil with the Caixa Econômica Federal, which operates the Cadastro Único while the Ministry of Social Development manages it. Some manage and operate by another central agency, like Colombia CISPEN, which is the National Planning Department. And some have one program managing the system, but for many other programs. When we say here managing and operating, we're meaning institutionally. It's not necessarily the way they actually manage and store the data, which could still be virtual. It doesn't have to be centralized, and some of them are not. Next slide, please. Self-reported info, which we just talked about, the direct collect information, can also be complemented by data from other administrative systems when you take a whole of government approach. With interoperability, data are pulled from other systems, such as the civil registry and ID system, the tax system, property registries, vehicle registry, education and health system, social security system, utilities, and so forth. By doing this, you can cross-check, verify, or even supplement information that's provided by households. Next slide, please. An example of this mixed methods approach of different types of data gathering would be the example of Chile, their social registry of households. They do have individuals, and in pretty much any system, you need at least an individual to make a claim and at least present an ID at the minimum. But in Chile, they have individuals report self-reported information on family composition, housing conditions, education, health, occupation, and incomes. That information is then also complemented by data from other administrative systems, including the tax system, social security contributions and pensions, unemployment insurance, health insurance, educational status, property ownership, and vehicle ownership. That social registry, which takes all that information to assess needs and conditions to determine eligibility for potential social programs, is also complemented and linked to an integrated beneficiary registry. And we're going to talk a bit more about what is an integrated beneficiary registry in a moment. Chile's system is updated in real time with an online platform and web interoperability. And importantly, the citizens have the right to access their own data in the system. And if they see anything that seems wrong or out of date, there are protocols for rectification, updating, and providing complementary information. Next slide. So how do these social registries function in practice? Here's one simplified example of the core implementation processes along the delivery chain. So it's the part of the delivery chain that with the blue, and then we go to the red. So the assessing, intake, registration, assessment part, and then the enrollment part. There would also be delivery chain mapping for payments, case management, et cetera, but I'm not showing that here because we're focusing right now on the social registry side. So this is an example from the country of Georgia. The process is somewhat similar in Turkey. And if you do anything out of this seminar, I would hope that this kind of tool seems useful to you. This is called what we call swim lanes. So each of those horizontal lanes in blue represents an actor. So there's the citizens, the local office, and in this case, the central social agency, and we've put the registry as an actor for that ministry because some of the processes are automated. So what you do is you map these swim lanes, and why do we call them swim lanes when you're swimming is because no one should swim into the other person's lane, meaning that you would have clarity of roles and responsibilities. So how does this work? Starting with the first step, citizens would go to a local office and fill out an initial application. 2, the social agent at the local office would receive the citizens in the application. 3, the data entry operators would enter the information in the system. And you can see now at the bottom, the TSA registry would receive that information and process it. Now, Georgia also has interoperability, so that TSA registry would pull information from other administrative systems like land, utilities, cadastral revenue, et cetera, and populate the application. The social agent would then receive that information from the other administrative systems, the more complete set of information, and then go do a home visit in this case to work with the family to provide a family declaration of the formal information that would be submitted. The data entry operators then do double data entry to avoid errors. The TSA registry, back again on the bottom in the blue, would receive that information from the family declaration, perform cross-checks and other transformations. It would then calculate whatever the eligibility criteria might be them categorical or other kinds of welfare measures. In this case, they use a proxy means test, but by no means do social registries only use proxy means tests. A lot of them use regular means testing or means and asset testing. But in this case, they would then take that information from both the family declaration and the other administrative systems, and they would push that information to other user programs that might want to use that information for eligibility, just the eligibility information. And then we move to the red part, where this one program for the TSA program, this Central Social Services Agency, would make an enrollment decision and then go through steps 12 to 15 to notify the citizens within 30 days of the status of their application. And by keeping information on all applicants, that would also allow those who are not approved to file a grievance, which is really important. And one of the reasons why social registries need to keep information on all applicants. Next slide. So we've seen the diversity in institutional, arrangements. There's also a lot of diversity in social registries in terms of population coverage. Some social registries have near universal coverage, like Pakistan, Dominican Republic, Philippines. Those are all census sweep systems. Then in the middle, you see a lot of the on-demand systems where you might have some self-selection, like Brazil's Cadastro Único, which is 40% of the population, although anyone can apply at any time on demand. And then some of them are very small. Often that's because these are very new, or they're very small, supporting just one or just a few very small programs, or they're just starting to build capacity, so they haven't expanded to national level yet. Next slide. We've been talking so far about the arrangements as if it was one program, but in fact, many of these systems are used for multiple programs. When you're implementing many programs, this can get complex. So if you're not combining these common processes, you can end up with a repetition. So you'll have each program carrying out all these delivery chains separately. So all of them are doing their intake, registration, eligibility determination, their decisions, their implementation, all of that separate. And that can get pretty complex. Next slide. In particular, the intake and registration process can be costly, and especially when there's fragmentation across programs. So people have to go through all these different doors. That's the visual of the doors. Meaning that they would have to go all over town to multiple offices, wait in long lines, provide the same documents over and over, and face the frustration of a complicated bureaucracy and time loss. Fragmentation is also challenging for governments. It results in duplications, inefficiencies, and wasted resources. Next slide. But what if there was a way to reduce that complexity? What if some of the processes could be combined? We've seen that many of them are very similar. It turns out the ones that are very often easy to combine are the ones for intake, registration, and assessment of needs and conditions. So integrated social registries is what we refer to when they serve multiple programs, and they become combined. They combine these processes of outreach, intake, and registration, and assessment of needs and conditions to allow people to be considered for eligibility, not just for one program, but for many programs. And thus they serve as an integrated gateway for inclusion of the poor and vulnerable. Next slide. This can create important efficiencies. For people, instead of having to go to many different offices, they can go to a single office and be considered for access to many different programs, usually through a common application form. For government agencies, they can share resources on the front lines for intake and registration. And in the back office, the integrated social registry would help improve the quality of data, the quality and accuracy of data, reduce duplication, fraud, and errors, and improve transparency, and thus save on administrative costs. Next slide. So as I said, many countries are actually using social registries as so-called integrated social registries to support multiple programs. Some of them only develop them for just one or a few, but then often they move towards supporting many programs. You can see here up to 80 different programs for Chile's social registry, and many of them serve as a gateway for numerous programs. Next slide. So what are some of the types of programs that are using social registries? Interestingly, they're not all what we would think of as targeted assistance. Many of them are actually more universal in nature. So in our work, we did a full sample of 20 countries, and we found definitely that all 20 countries were using their integrated social registries to support cash transfer programs. That's kind of the obvious. Many of them also use them for social energy tariffs, social pensions, and other allowances. Nearly a dozen of these social registries were using them to calculate subsidies for health insurance, and health insurance being a more universal benefit, but then to try to allow for targeted support to the lower income households for larger subsidies. Many of them use them for housing benefits, social services, productive inclusion, and other labor services. And I wanted to point out one interesting unexpected example, which is legal services, which Chile and Georgia are doing. So around the world, the poor do face legal challenges. Sometimes they require legal support, such as pro bono legal services or court fee waivers. But the justice system doesn't have the time or resources to assess everyone that comes through their doors to determine eligibility for those court fee waivers or pro bono services. If people were already registered in the social registry, they could qualify for those services automatically, and that's how it functions in Chile and Georgia. The justice system just needs to query the social registry and find out if the people qualify, and they're automatically granted free pro bono legal services and court fee waivers. Next slide. A really important feature of social registries is what we call the principle of dynamic inclusion. The principle applies when registration is open and continuous. That's usually with on-demand applications, online or in person. This means that anyone can register or update their information at any time. Now, when you register, there's no guarantee that you would have eligibility for benefits. But just being able to register and update your information would allow for that dynamic inclusion into the registry. That principle is very relevant for the human rights agenda and the progressive realization of universality, meaning that anyone who needs social protection can access it at any time. Next slide. Unfortunately, not all social registries are dynamic. Many countries operate social registries with what we call sort of fixed lists of applicants and beneficiaries. These are often carried out with the en masse registration waves, but only every 4 or 5 years. So they don't carry these out every year. And then in the interim years, the registration is basically closed, although sometimes they have small windows for entry through grievances. This is a common starting point in many countries, and that's actually a pretty normal starting point. If you have no data, you have really limited fiscal resources, small budget, limited administrative capacity, it might be that you do a census survey sweep to collect your initial information. However, as time goes by, those data become out of date, and the risk for errors of inclusion and exclusion would increase over time. The reliance on these static systems can be problematic when these fixed list systems serve as integrated gateways for multiple programs. So if the social registry hasn't been updated in 5 years, but it's providing access to many programs, then you have a larger risk of inclusion and exclusion because you potentially are keeping people out of a lot of programs, which is why you'd want to have more frequent updating, or at least possibly even move to an on-demand system. Next slide. So we see a range of trajectories and typologies of social registries as inclusion systems. So on the vertical axis here, we just plotted, are these social registries integrated? Do they serve one program or do they serve many programs? And on the horizontal axis, how often, how frequently can people access? Is it at any time, infinitely, at any time they can go access, or is it only infrequently, like every 3 or 5 years? We plotted the different countries as they are right now, but they'll change because these systems are changing and improving their capacities. But you'll see a group of them with the en masse approaches that are, many of them are infrequent, but some of them do serve many programs. And then you'll see the more on-demand systems in red, where people can register at any time. Azerbaijan's just for one program, but the other ones serve many programs. Brazil is an interesting example because actually Brazil went horizontal, meaning that they went for dynamic capacity before they went integrated, meaning that they expanded the on-demand window after one nationwide recertification in 2005 and 6. They have since operated their system entirely on demand with active outreach since 2007. And people have to come to the office and update their information every 2 years. Well, they developed those on-demand capacities before they finally opened it up to being used by many programs, the Cadastro Único, under the Brazil Sem Miséria strategy in 2010. And now the Brazil Cadastro Único is used by 30 programs, but that was only after they had the on-demand capabilities. Next slide. So we've mostly zoomed in on social registries, but now let's zoom out from social registries for a second, because they're only one part of a broader information system. They don't operate in isolation. Other components typically include beneficiary registries, and as we mentioned earlier with the delivery chain information systems to support payments and case management. And many countries are using these different modules or components of their information systems for many programs, multiple programs, and that would be forming integrated social information systems. Next slide. So let's just talk about the red component of that, the red bubble, the integrated beneficiary registries, which again goes back to that enrollment phase. With one program, the beneficiary registries simply capture the information on the beneficiaries of that program. When you have multiple programs, something you really want to be able to do is to monitor and track and coordinate who receives which programs. Well, to do that, you need to connect information across programs on the beneficiaries, and that's called an integrated beneficiary registry. And that's a really important social policy tool that complements the social registry, which is more upstream for eligibility. So this is more of an analytics data warehouse type of tool that allows for planning, budgeting, coordination, and monitoring of who gets which benefits. Next slide. So this is just putting it in terms of the where that is in the delivery chain. So it's a dashed line because it's not actually a transactional thing. You're just linking the information across these different programs on who receives them. And then you pull that information so you can coordinate that. And then you can look at gaps, duplications, etc. Next slide. So then what if you had both of these components? So some countries have both. Interestingly, some countries have only one or the other. So for example, some countries might just have the panel on the left, the blue, which is the integrated social registry, like say Brazil. They have their Cadastro Único, and there's people there because that's a transactional system where people can apply at any time to be considered for eligibility for all those different programs, to get in potentially to those programs. That would maintain information on all applicants. Brazil does not have, however, the part on the red, the integrated beneficiary registry. So they have no way to tell who receives what benefits across programs, especially those that are outside the social ministry. They can coordinate that for those within the Ministry of Social Development, but for any programs like housing and others outside, they can't tell who receives that and say Bolsa Família. Other countries operate only the one on the right-hand side. Say, right now, Kenya's main instrument is the integrated beneficiary registry, and it's very innovative, and it allows for coordination, planning, and monitoring of who receives what benefits. So they have that link across programs, but they don't have the integrated social registry side, which would capture information on all applicants and do that in a way that it would determine eligibility for programs as a common gateway. Some countries have both, like Turkey and Chile, and that they operate those within integrated social information systems. This is a really powerful social policy tool because in some senses, the left-hand side, the integrated social registry, is a measure of demand for social programs. And on the right-hand side, the red integrated beneficiary registry is a bit of a monitoring of the supply of different programs. And then you can look at gaps and duplications. You can do all sorts of profiling to see what types of beneficiary personas receive different bundles of benefits and services and which ones might be missing certain types, and you can try to offer them and cost out what it would cost to offer them more. You can remount duplications, etc. So having the two together is extremely powerful. It's also very powerful for crisis response because you know your demand side of the situations of the people before a crisis hit with the social registry, and then you know what benefits and services they're already getting with the beneficiary registry, and you can really coordinate the response to crises. Next slide. Just as mentioned earlier, even these integrated social information systems don't operate in isolation. Most governments that are operating these are doing it with a whole of government approach, meaning that they link to other information systems outside of social protection, like the tax system, civil registry, property, vehicles, education, health, etc. And they do that through interoperability. That requires institutional coordination, information sharing protocols, data protection, interoperability, and sustained political will. That coordination. Almost done. Next slide. So as we've been saying, and you've seen, there's clearly a lot of diversity in these systems, and there's really no blueprint for them. Each country has been developing them on their own trajectories, and they're at different starting points, different points in time. Here are just three examples. The Philippines Listahanan, formerly called the National Household Targeting System for Poverty Reduction, but now called the Listahanan. It's an integrated social registry, so it serves over 50 programs. It's carried out with a census survey suite. The last one was undertaken in 2015, and the system now covers over 75% of the population. But they don't have an integrated beneficiary registry across all those user programs. Brazil's Cadastro Único is an integrated social registry, but it's an on-demand system, as I mentioned. Since 2007, it's continuous on-demand at any time via municipal offices. And it now serves 30 programs, not just Bolsa Família. But as I mentioned, Brazil does not have the integrated beneficiary registry, so they don't have a way to track programs. They're working on that now. Then finally, on the right, Chile, also an on-demand system for their social registry, but they operate both sides to that. So they have both the integrated beneficiary registry and the integrated social registry. Their system now covers over 75% of the population because it serves over 80 programs, and many of those are universal and current. It has its fully interoperable in real time. Okay, almost done. Next slide. So you can learn more about these different systems and characteristics of social registries in the context of these broader information systems. In our study, and the link should be provided, or the paper should be provided, we just looked at a sample of 20 countries, but we are working actively in these systems in, I think, about 80 countries around the world. This was just a sample of those, but gives a nice flavor of the diversity of these systems. Next slide. And finally, last slide. Our paper also is mapping out an initial assessment tool for social registries. We've sort of grouped the assessment tool that could be useful if you wanted to look at assessing your existing systems, and then maybe what would be a system that you want to try to move towards or improvements. So you could do gap analysis, etc. So it would group that into what are some of the main characteristics. Part one, just sort of characterizing the social registry. Is it on demand or census sweep? Where do you, maybe you want to move towards on demand? What are the types of information systems? The key structural features is the next set, such as the institutional legal arrangements, the citizen interface, which is really important. What's that point of contact for people to register their information? And then what are the user programs? The third block that we look at in the assessment tool would be how social registries support the delivery processes of outreach, intake and registration, updating grievances. And the number one thing I would say for that is do those swim lanes, map out your delivery processes by institutional roles. We do that all the time, and that really should be the anchor for anything that we're looking at, because the functions of those swim lane analyses will help determine the functions you need in your information systems. Then the fourth block in green is the core information systems aspects, such as data and information, software applications, database management, interoperability, infrastructure, information security and protection, etc. And finally, we look at some ways to monitor and assess performance about looking at inclusion, like coverage, efficiency, like service standards and time and accuracy of data. And this is a working paper, so we're always looking for feedback, and we would appreciate it. Thank you. Oh, sorry, one last slide. Concluding remarks. Just to summarize, social registries are both inclusion and information systems, so their function is for inclusion, to provide a gateway for people to apply or register to be considered for eligibility for social programs. And the operation is as an information system. The so-called front office, that's where the people have contact with the system. There's a lot of diverse arrangements for that. They can serve as integrated and dynamic gateways, ideally dynamic, providing continuous applications at any time. In the back office, there's diverse institutional arrangements. And finally, social registries are only one component of broader information systems that are very much complemented by the integrated beneficiary registries, the information system components supporting payments, case management, etc. And when you have all of these, you have a very powerful social policy tool. Thank you.
Thank you so much, Kathy. That was an absolutely fascinating presentation. You know, we could have had a whole another discussion just on a number of the slides that that you presented there. You've certainly whet our appetite for more, and as Kathy indicated, for every full report bank in the handouts and the GoToWebinar, and his invitation to this webinar. So lots of ways to find it, and I certainly highly recommend reading it. Just before we hand over to Valentina, don't forget today's your opportunity to ask those you have on this fantastic presenters here today who can personally answer for burning issues. So send them through on the chat function as Valentina does her presentation, and we'll have Q&A directly after that. So without anything further from me, thank you so much, Valentina.
Okay, thank you, Joanna, and thank you, Kathy, for that sweeping overview. It's incredibly difficult to cover so much content in so little time. And my role will be to take a bit of a step back and give you a bit of a 101 background, especially for non-IT people. So I excuse myself for people who come from that type of background, because my spoiler is that ultimately the issue is not with the technology. The technology is not the main barrier. The barrier is how we actually design a system to achieve policy and operational outcomes that we want it to achieve, and the variations in operationalization greatly affect outcomes. Kathy's already started touching on this. So if we go to the next slide, what I'll be discussing is based on the DFAT document that you can see now on the slide. There's a wealth of information in there, so if there's anything that you didn't understand, you can go to this document and find more information. There's in-depth case studies from Brazil, Chile, Turkey, Kenya, and Indonesia, which were co-authored together with a wide range of people, and I'm sure some of you might even be online today. If we go to the next slide, I wanted to start, I said I'd be taking a step back, and one of the first things I wanted to do was, this is a wordle from about 20 different countries and how they call their information system for social protection. And as you all probably know, every single country calls their system a different thing. We've got unified registries, poverty databases, social registries, single registries, integrated social information systems. We're using a lot of different words, and ultimately very often we're trying to describe similar systems. What we should be careful then is not to focus on the name of what a country has called its system, and this derives from its history, its trajectory, and Kathy went into that, but what functions it's performing and what it's actually capable of achieving based on how it's been built and designed. The only words that you might have noticed that Kathy didn't use the word single registry, and there's a reason for this. The word single registry was originally coined as a mistranslation from Brazil's Cadastro Único, which is now being translated as unified registry, not single registry. And the word single is misleading because it leads us to think that there's only one system in country, and it's a word that's being used for systems with very different types of functionalities. So that's why we're avoiding this word. If we go to the next slide. Again, in taking a step back, if we actually look at the information system, what Kathy's been calling integrated social information system, you could call this social protection information system. It doesn't really matter. This is the wider information system. At the center of that information system, we have the people who are setting the requirements, kind of what should this information system be doing? What information do we need it to provide, and why, and for what function? Then there's a software interface that's designed in order to achieve that, working together with a database where a data repository where that data is stored, and using kind of some underlying hardware and approaches to data exchange. If you click, one important thing that's coming out from a lot of the evidence in country is that we need, especially at national level, the capacity of those people who are setting the requirements to be hybrids between the policy understanding of social protection, so what is it that we need to achieve, and the technicalities of how we can achieve this through an information system. And it's actually quite rare to have that type of capacity, and countries who've been successful in this have invested a lot in that type of capacity at national level, with units of 20 to 40 people at national level working exactly on this. If we go to the next slide, so what is it that this hybrid kind of half monkey, half chameleon type of person what should we be trying to achieve at a policy level with these information systems? The data is ultimately there to serve our policy functions. So first of all, we'd want a system which guarantees a more equitable distribution of resources across jurisdictions. We want that pastoralist in the north of Kenya to have similar rights to someone who's in Nyanza province and in richer areas of the countries. We'd want increased responsiveness and inclusiveness of interventions based on the use of that data, so addressing not only the needs of the chronically poor, but also life cycle risks of other population groups, job loss, childbearing, old age, and also other shocks, economic and social, and disasters. We'd want harmonization across programs, increased coordination. We'd want that information system to help us to achieve, support the implementation of the social protection floor and progressive realization of rights, and especially coordination across social insurance and social assistance. So that's a really important aspect of that. How does a country fare across those two? Ideally, it could support linkage to wider policies, so ensuring, I mean, Kathy was mentioning how social health insurance can be linked to a social protection information system, increased transparency and accountability thanks to the fact that information can be shared and compared, and ideally available to a wider public beyond the few people who are implementing a program, and knowledge. If that information is used by universities, by research organizations, there can be a wealth of knowledge on poverty vulnerability in a country that can be generated thanks to this information. If we click to the next slide, from an operational perspective, there could be huge advantages of integration of data and information management as well, in terms of oversight and reporting, so oversight of multiple schemes, potentially monitoring multiple payments across programs, or in some countries where this is an issue and it's not necessarily an issue, controlling double dipping across programs. Improved budget planning, so based on that information, Kathy told us that we can have information from the supply side and from the demand side, and improved budget planning based on that type of information, modeling and testing of policy changes based on this information, potentially reduced burden on staff and on applicants. And on staff, we have here a photo of a lady submerged by paper in her office. So potentially a digitized information system can help to reduce the paperwork and the burden of paper reporting. And for applicants, Kathy's touched on this a lot, there's huge benefits in terms of being able potentially to apply for several programs at once, faster processes. In Turkey, we know that the introduction of the information system brought the application time down from 15 to 20 days down to a day, as an example. Avoiding duplication, for example, of data collection, but also establishing common systems across programs. And several countries have now been establishing, for example, common payment systems, common grievance mechanisms across programs, and kind of reaping that type of benefit in terms of shared information. Better managing error and fraud, transitioning between schemes, and I haven't written it down, but potentially even portability of benefits based on a wealth of information across at national level, and also more effective shock response. So potentially the use of existing social protection data in the aftermath of a shock in order to do horizontal or vertical expansion of benefits. If we go to the next slide, the issue is that this integrated approach to information management, of course, brings a whole series of risks with it. And on one side, we've got increasing costs and complexity, especially at the initial stages of design. And a lot of countries have been going through this and have been, most of them, almost all of them have been receiving quite significant amount of donor support. And it does call for higher capacity, quite strong leadership. And there's a bit of a fallacy to be that I want to bust the myth that these information systems, yes, they can increase coordination, but they do require huge amounts of coordination in advance in order to set them up and build the legal frameworks for them and institutionalize them. So there's a lot of complexity and a lot of policy issues to tackle in order to set them in place. Data privacy and security I'll be coming back to, so I'll skip for now. And a big challenge with potential multiple exclusion from all social sector schemes, and potentially systematic exclusion of certain types of households. So of course, this is an issue that happens even at program level, but there's always a chance maybe that a person who hasn't been included in one program might be included in another program when there's only one entry door, one gateway, that this can become a problem if the system isn't designed for dynamic inclusion. There's also all of these benefits and all of these risks I've been discussing, they come, the risks and benefits that countries face vary hugely depending on how they've set up their system, and there's trade-offs that countries need to face up. So this is really the core of where I want to get at, and I'll be revisiting these benefits and these risks based on some of these core variations. So if we go to the next slide. Before I go any further into these core variations, I want to give you one clarification on the difference between integrated beneficiary registries and integrated social registries, as Kathy has been describing them in great detail, but I want to give one clarification in terms of the data flow. So while at the top we have that integrated beneficiary registry where the data flow is going from left to right, we've got data collection which is happening potentially in different ways at program level, and then that information is being consolidated at national level. For social registries, we've got some approach to data collection, and I'll go into Kathy's already mentioned some variations. I'll go into this a little bit deeper. That data is being consolidated at national level. Some form of an eligibility formula is being established at national level, and then programs either take that eligibility formula as it is, but actually most often adapt it to their own purposes depending on what their eligibility criteria are, and in some cases don't apply that national criteria at all. There's countries also where in Turkey and Chile, there's been quite a lot of experimentation with having local level administrators, giving them a chance to override what the national information system is saying in terms of who should be in and out of a program. So in Turkey, for example, they have a board of trustees who has the ultimate decision-making power beyond what the data is actually showing. And this board of trustees makes a decision which is then inspected by 3 different auditing institutions. And in Chile, if, for example, a person has an asset which shows that they might not be eligible for a program, but that asset is necessary because I don't know, a car, for example, for taking an elderly member to town for health services, that car is not counted against them. So more flexible systems which are using this national system and adapting them at program and at local level. If we click to the next slide, another clarification on the data flow is that you'll recognize at the bottom those 3 elements of the framework that Kathy talked about. So while assessment, decision, and implementation for that integrated beneficiary registry component very often happens at program level, for the social registry, the assessment happens at the social registry stage. The decision happens at the program level, and at enrollment stage, Kathy already mentioned that there's very often additional practical data being collected. Who is the alternate recipient? What are the bank account details? How should we actually operationalize this system in order to deliver payments? But an additional data collection very often also happens at implementation stage. When programs are implementing, they're collecting additional data as they're going along, including changes of addresses and kind of very practical information that helps to better deliver to citizens. So if there's no data flowing back from the programs back to the social registry, there's a high likelihood that the social registry doesn't have as up-to-date data as the underlying programs. And that, for example, was recently a case in Pakistan with the National Socioeconomic Registry versus the BISP registry, having more up-to-date information. Now, Kathy has repeated this a lot, and I'll repeat it one more time. These 2 systems, they're overlapping and complementary. The issue is that very often countries start with one or start with the other. So this is why I wanted to clarify this further. If we click to the next slide, I'm going to now look at those variations in operationalization from 2 perspectives. The first is from the data repository perspective, and then I'll look at it in terms of how that data is actually used and managed. So if we click to the next slide, Kathy's touched on this, about these three variations to how data is collected: census survey, on demand, and additional use of data integration and existing data. Now, what I want to stress is that the key areas, outcome areas that these three, the choice and the trade-offs between these ones pose is that they affect exclusion and inclusion areas and potentially fairness of a system. So for example, imagine a woman who becomes pregnant after a census survey sweep has happened in a country with a child grant program or a mother and child program. She will be non-eligible, while her next door neighbor will be eligible because she has a slightly older child. Up-to-dateness and usability of the data, on-demand systems, Kathy has told us, are basically allow for data to be much more up-to-date, ease of access for applicants, and data quality. The next slide I'm actually going to skip over because we don't have too much time, and Kathy's already gone into this. But the slide after that just gives you some background on where countries are sitting along this spectrum of census survey versus on-demand versus data integration. You have a lot more detail in an infographic. It's a draft infographic that we've shared with you as one of the handouts for this webinar. And if you have any comments, if you feel any description is non-precise, please let us know and we'll be very happy to change this. This is currently in draft format, but what it's showing you is how variations in operationalization affect these outcomes at the bottom. So you can see how Pakistan, Philippines, Indonesia primarily have started off with census sweeps, and all three of them are piloting on-demand systems. And those census sweeps, they were planned to be scheduled every 2 to 3 years, and they've ended up having quite a large gap between them. And on average, across the countries we've looked at, that gap has been around 6 years, and which is beyond that 2-3 years recommended updating. In Chile and Turkey, and Brazil, there's primarily an on-demand data collection approach, and in Chile and Turkey, that is strongly complemented by that existing data. So there's almost a principle that no question should be asked to a citizen if data already exists that answers that question. We've already seen the case of Chile. In the case of Turkey, data is being drawn through 111 different web services with 22 public institutions, including civil registry, social security, tax, vehicle ownership, school MIS, health MIS, etc. If we go to the next slide, the way that data is collected affects coverage, but also that there's a distinction in coverage between integrated beneficiary registries and social registries by definition. So if the country's population is the red circle, an integrated beneficiary registry, because it's focused on existing beneficiaries, tends to be relatively smaller. The size of these circles is arbitrary on this picture. It can increase quite significantly if that integrated beneficiary registry includes information on recipients of social insurance, and that would be an important step for countries to be moving towards, especially if they want to guarantee that kind of integrated vision across the social protection sector. For social registries, the size of the blue circle varies hugely depending on the data collection approach, but also a few other design choices that I'll very briefly touch upon. And the overall coverage affects the potential for targeting multiple programs, the potential for shock responsiveness. How likely is it that a person kind of living in the drylands is actually included and affected by a shock, is already included in the social registry? Do we already have that data or not? It affects the potential for policy analytics, including planning and costing, and use cases for other sectors. So on the next slide, I'll be brief on this because Kathy's already touched upon it. Kenya's single registry, which is at the moment an integrated beneficiary registry, which is actually shifting in focus right now, kind of as we're speaking, has a coverage of around 8% of population. Indonesia's DB has a coverage of just over 40% of population, and the reason is that there's it's a census survey approach, but there's an explicit focus on the poorest 40% in the data collection. So using the census survey and other existing statistics and some validation at community level, data is only collected on those that are perceived to be the poorest 40%. Brazil, Turkey have got on-demand systems. If we click, you can see that one thing I wanted to show you is that Chile, despite having an on-demand system, here that the numbers are wrong on this slide. I think there's something that has happened with the, but Chile's got about a 75% coverage of population, and despite being an on-demand system, and that's because Chile, from a policy perspective, has got a strong focus on a life cycle universal approach to delivering social protection. So that the percentage of population who's ever applied for a benefit in Chile is dramatically higher compared to some other countries with an on-demand systems, but a strong focus on poverty-targeted programs. So then, and the next click just shows that that data integration for Turkey and for Chile does potentially enable large amounts of information to be already available from existing databases up to 100% of population. If we click to the next slide, another important kind of variation in operationalization that we sometimes forget is that these registries in different countries focus on different population groups and on different data. So are we focused, I mean, the first distinction between beneficiary or potential beneficiary is the distinction between a social registry and an integrated beneficiary registry. The second on, are we only focusing on the poor and vulnerable? Is that the current Indonesia approach, which is now being revised, or are we collecting data on potentially up to 100% of population so that we can serve anybody in need? Are we just focusing on citizens or also temporary or migrant populations or non-citizens as such? And that's very often a highly controversial decision. Different countries have taken very different approaches to this. And also, are we focusing on individuals or household level data? It's very rare that existing databases have household composition, for example, as a variable. So if the underlying programs require household level targeting, then data will have to be collected on household composition. In terms of what type of data, the number of variables and type of focus of different registries is very different. Some collect extensive socioeconomic data that's also used for other sectors and primarily for poverty-targeted programs, but some only collect more basic social demographic data, which because categorical programs tend to have lower data requirements. Operational or not, I touched upon this briefly when I showed you the data flows, that sometimes social registries might miss out on some of that more operational information which is collected at the enrollment stage. So countries in Kenya, the Hunger Safety Net program is an interesting example of a choice to pre-enroll 100% of households so that in cases of shock, assistance can be easily triggered and sent to all the households that have been pre-enrolled. Otherwise, at the snap of within 24 hours, it would not be possible to actually operationalize that data if that operational information weren't available. And also variations in terms of what is the approach to identification. Is there collection of biometrics through some form of functional ID creation for social protection? Are we piggybacking on a foundational ID system if we have one? We'll be looking at this very briefly later. And all of this affects, again, the potential for targeting multiple programs, potential for shock responsiveness, use cases for other sectors, but also issues around fairness and inclusiveness. If we click to the next slide. So here is where we focus on how that data is managed and used. And so if we go to the next slide, Kathy's mentioned the importance of interoperability and data sharing, and she's also mentioned the fact that why we might want that because existing data can serve as a data source, as in Chile and Turkey, and we've discussed this before. So existing data being drawn from existing databases, that triangle at the bottom represents additional data collection, because it's very rare that existing data is sufficient, especially for countries that have some approach to poverty targeting. There's one example from Thailand of the national ID database being drawn as a data source together with private sector and public sector social insurance databases, and the one minus the other is all the people who are not currently covered by social insurance, and that's a group of people to whom transfers can be made by collecting very minimal additional operational information. But existing databases can also be used for data verification, validation, potentially deduplication in the case of a national ID database. But there's also other uses, and I'm going to just quickly brainstorm with you on some, if we go to the next slide. Just in terms of who might we be sharing data with and why. And there's a table within our document and within the accompanying policy brief that goes into quite a bit of depth on this. So I'm going to touch on this quite fast. I want to give some time for questions, but civil registration, drawing information from civil registration can be incredibly important to guarantee an inclusive, updated system, especially for countries who have a focus on child grants. The second a new child is born, that child could be entered into the system. A death registration system could also help to exit households who have died, and the national ID database could serve as a fundamental data source to give us a sense of the underlying population, and it can act as a source for authentication, deduplication, etc. For banks, data flowing in both directions is important in terms of coordinating payments across programs, and countries such as Kenya, Turkey, and others do this, but also authentication and reconciliation of payments across programs for data flowing in the other direction. For social assistance programs, we've already gone into this a lot, that drawing data from the social registry could enable them to use that data for their targeting purposes, but they could programs could also benefit from further integration established at national level. So they could also benefit from the fact that at national level a link has been established with a national ID register, and individual programs can benefit from that. And they could also access that integrated M&E system if the system has been set up so that the data is flowing back. Very often the data is only flowing one direction. Kathy mentioned Brazil, so Cadastro Único giving data out to programs and then not being aware who's receiving what across those programs. In terms of social insurance, there's of course all the advantages in terms of integration and coordination if that data is shared, but also the potential for creating complementary packages targeted at social assistance recipients. For decentralized governments, especially in decentralized kind of contexts, it's very important that they should have access to data themselves, not only to be able to run their own programs, but also for improved planning and for other purposes. And very often that they're forgotten from the picture when data is managed kind of very centrally at national level. Other line ministries, their data can be used for monitoring co-responsibilities, conditionalities, and Turkey again does this. I mean, but that's only in cases where your education MIS and health MIS are reliable and continuously up to date, which is incredibly rare. Potentially research and academia. We talked about knowledge at the beginning, and Chile and Brazil are exploring approaches to make their data more easily available to research and academia in order to be able to generate that knowledge. and potentially development partners. You'll see these lines are all dotted. Development partners could either provide their data as a data source, and that's been the case in Kenya, for example. The integrated beneficiary registry draws data from WFP as well, and I know in Mali that's now being explored. There's also the potential to share data with development partners in very specific use cases, and recently there's been a lot of experimentation with disaster response piggybacking on national social registries, as for example in Pakistan. So if we go to the next slide, the background problem with all of this, and I mentioned this before, is the data security and privacy, so that the huge risks of misusing or losing this wealth of information, exposing households to further vulnerability, or even of creating some form of dependency from the private people who've developed the systems or are storing the data, or risk of surveillance states. And just to give you a sense that this is not some post-apocalyptic type of discussion, there's been two recent examples here in the US, where I'm currently based, with Equifax compromising 143 million people's social security numbers, and with President Trump most recently trying to use an existing database of the children of illegal immigrants to the US who'd volunteered that information to be able to have some security guarantees to use that information against them. So this potential misuse of information is a big deal, and it's a big problem, even where data security is taken very seriously. And in the background, there's problems around how that data is collected, and the fact whether consent is truly informed in terms of how that data is actually going to be used, who is going to be shared with, and how. And I think very few countries actually do that to date, kind of taking consent seriously, not just as a tick box exercise. In terms of data storage, there's of course huge amounts of protocols and international legislation, so I'm not going to go into that. It's documented in our report, but what's important here is the potential even for data to be stored externally, and I know at least of two cases of countries who don't even store their national social registry data in country. And in terms of data sharing, of course, a kind of web service type of data sharing, secure data sharing is ideal, but very often countries do have to recur to email, CDs, USB pens, and there's large risks associated to that. Recently in the UK, a USB stick got left on a train with which secure information. So it's there's protocols that need to be built around not just the hyper secure perfect IT world environment, but even where technology is more of an issue. And in the background, all of the issues of what protocols should we be signing to ensure this. And the countries who are ahead on this, they've spent years working on all of this legal backing and the underlying protocols and service agreements with municipalities, with other data providers at national level. So if we click on again, I'm going to try and be very brief on the role of ID. Is a foundational ID necessary? So a national ID designed to support multiple services. Of course, as we know, if you're trying to match data, having a unique identifier will be incredibly useful in that context. But we know from the work that ID4D do at the World Bank, that, for example, in Sub-Saharan Africa, only 29% of people have a national identification. So many countries don't have that type of infrastructure in place in order to reap all the benefits of linking to a national ID. So instant integration across programs, creating an audit trail, all of the benefits of deduplication, etc. There are ways around this. Brazil, for example, has been adopting for years a data matching algorithm and accepts any form of ID, and then uses name of the person, name of their parents, and a few other variables to match across databases. There's also approaches to link ID and social protection. Kenya, Lesotho, they've been incorporating civil registration and national identification as an objective of social protection, sometimes even sharing registration desks. In Pakistan and India, there's been a lot of leveraging social protection and other services in order to expand ID coverage, sometimes in ways that have been deemed controversial by some. So if we go forward, another key issue in the background is what is the original reason for integration? Kind of why are we doing this in the first place? So if we click to the next slide, sometimes three different approaches are seen as mutually exclusive. So either focusing on determining eligibility of households in an integrated way, if the slide's not clicking, or focusing on integrated program management across different programs, so administering programs in an integrated way, their payment system, their case management, their grievances, for example, or a focus on monitoring and evaluation, oversight, planning. The slide is still not clicking. I'm going to go ahead. What's important from this perspective is that these three objectives, potential objectives of integration, they are not mutually exclusive, and ideally countries should be focusing on elements of all three and ultimately focusing on better serving those in need. And at the same time, they should be mitigating all of the risks and trade-offs that come with some of these choices that we've been discussing. And in doing all of this, maintaining a long-term perspective, because there's some benefits that are only seen over time and not in the short term. So what trade-offs am I talking about? Expanding coverage versus reaping the benefits of on-demand systems and reducing costs. Trying to abide by all of these issues with privacy and security, while also ensuring transparency and a wide variety of use cases for government. Avoid duplications of effort, for example, in terms of data collection, but at the same time, avoiding risk of multiple exclusion. Is the slide really not working? Because for the next slides, it would be amazing if I could have the slides. So the organizers are saying the connection is bad. Okay, they're trying to figure it out. Okay, I'm gonna conclude. It's just a pity not to have the slides here because it's quite important to see this visually. That basically at the beginning we talked about all of those policy objectives that we might want to be achieving. So more equitable distribution of resources, increased responsiveness and inclusiveness, coordination, universal coverage, linkage to wider policy, transparency, accountability, and knowledge. So the problem is that in order to achieve those, there's quite a lot of things that we need to set in place. So if we want to have more equitable distribution of resources, responsiveness, inclusiveness, coordination, we need to ensure that our data collection approach, that we have addressed those risks of multiple exclusion, et cetera, et cetera. Similarly, for those same three policy objectives, and my pretty slide was linking this with arrows and you're missing out, we'd have to ensure that there's a focus on increasing coverage, having information on non-beneficiaries, not just current beneficiaries of social protection, a focus on non-citizens, et cetera, et cetera. In the background, really important to have, again, it's about a cart and horse problem, that if we want to achieve all of this, there needs to be a policy focus on inclusiveness and universality in the first place, otherwise the information system won't be geared to achieve that. And there needs to be kind of ease of data exchange and ensuring easily accessible, for example, data available online in order to ensure transparency, knowledge. Brazil has developed a tool called Checkad where researchers and other stakeholders can enter with a predetermined authorization level with anonymized data to use the full extent of the Cadastro Único database. I really wish I'd had my slide here, but it's still not there. Do you know, would it be worth doing some of the questions and then I come back to this? Because it's quite difficult to explain without the visual. Joanne, I don't know if you're ready.
Thank you.
Yes.
Yeah, already. Because of the connection issues, I'll continue without my video on. Look, we only actually have 5 minutes left, so we will go to questions. And there is a really wonderful long list of fascinating questions that are coming up. I guess we won't be able to answer all of them in the next 5 minutes, so we might just answer 3 or 4, or maybe 3. But the rest we will answer and ensure that they're on the online community so that you can see those answers. There was a question.
Sorry, Valentina, I think your slide is up. Can you see it?
Yes, I can now, actually. I don't know.
Maybe she should just go ahead and finish it so she can complete the presentation.
All right, absolutely.
What's up? Go ahead.
Sorry about that. Yeah, I'll be super fast. So this I've already gone through from the policy perspective. You can see how in order to achieve these things on the left, we need to have these things on the right. And if we go to the next slide, and apologies for the issue. If we want to achieve these operational advantages on the left, if you click through, first of all, if we want oversight and transition between schemes and, wait, sorry, just one click at a time, we'd want data flowing back from the programs and an explicit focus on M&E, otherwise that oversight will not be possible, transitioning between schemes will not be possible, and that management of error and fraud across programs will not be possible. If you click again, of course, in the background of all of this, there's a need for some form of a unique identifier or an approach to identification that helps to address this, and there's big potential for exclusion there that needs to be managed. If you click again, we talk about reducing burden for staff and for people, but if we don't focus on their needs, so if we're just suddenly transferring over a complex information system and ask untrained staff to enter a whole lot of information and use a system they don't understand, they're not IT literate, that will create huge barriers rather than reduce the burden. And similarly with citizens, if we don't focus on their needs, and that leads to the next one where back office, if you click, back office integration needs to be complemented by front office integration, kind of ensuring that there's a clear gateway for people to be applying across multiple programs in one place. The next click again is about the cart and horse problem, is that in the background we need that policy vision and coordination in order to make all of this happen in the first place. It's not that an information system will automatically lead to further coordination. And for shock response, there's big issues around having sufficient coverage. If you go to the next click, having information on non-beneficiaries as well as current beneficiaries, because it's very unlikely that current beneficiaries of social assistance programs will be coincide entirely with the population by a shock. Going to the last slide, so this was my spoiler alert at the beginning. Basically, there's no one solution. This is the obvious answer. Countries should be focusing on their need, on their context, what they have in place. And the most difficult challenges are not those technological challenges down at the bottom, though I'd mentioned that technological lock-in can be a problem. So relying on one organization, one private provider, and then getting stuck with them because of a use of proprietary software. The issues to be tackled really are very much at policy level, kind of what are we trying to achieve? At administrative institutional level, how do we set this up to make this work, and how do we ensure that level of capacity? I've mentioned many countries implementing such systems have got national units of 20 to 40 people working on just this, and memorandums of understanding with every single municipality in the country, for example, in the cases of Chile and Brazil. So that takes a lot of time to build, and the operational implementation aspects I've been discussing up to now. So Thank you very much. I'm going to hand over to questions, and apologies for the technology glitch. See, it doesn't always work.
Thanks so much, Valentina. That was also a fantastic presentation and a great compliment to Kathy's as well. Certainly lots for us all to think about. In terms of questions, we had a question around the extent to which common delivery mechanisms are being used and whether or not there are any cases of countries leveraging common delivery mechanisms. I wonder if you could respond to that one.
Yeah, so I believe you're referring to like common payments gateways. I believe that's what you're referring to. So if you think about it, like on our slide for the delivery chain, there was the blue part, which was the social registry aspects, which are functions, which are related to the intake registration, eligibility determination. And there was the red parts, which was related to the beneficiary registry for enrollment decisions. And then there's the purple parts, which was the actual implementation and delivery. And I believe that you're probably referring to common or integrated payments gateways, which is related to that purple part. That wasn't so much the topic of this presentation, although we are working on that quite a bit. It can be cost-effective, timely, and user-friendly. We do have other materials on that. There's an ISPA tool on payment systems, and there's a whole lot of work going on about payment systems in most of the countries we're working on. So we could provide some links to further information on that at another time. Joanna?
Fantastic. Thanks for that, Kathy. We had two questions which related to sort of evidence and thinking around social registries and integrated beneficiary registry in low-income countries. So I'll bring those two questions together for you both to reflect on. One participant wondered whether integrated beneficiary registries have a role to play in low-income countries where there's a fragmented environment and donors are motivated to invest in the systems for their specific programs rather than system-wide registries. The second question was, what is the evidence of investing in a sort of countrywide registry system rather than at the program level, bearing in mind some of the shortcomings that were mentioned that might apply to low-income countries, such as data being out of date, etc. I wonder if that's one that Kathy, you might.
Sure. I mean, so I think that the challenge, it sounds like the challenge of these questions, one is, you know, the issue of fragmentation. I can say all countries are struggling with that challenge, be them lower income countries all the way up to the high income countries. We just visited Montgomery County last week, and then we were looking at their integrated case management system, trying to make, you know, some kind of sense out of the chaos that they have to deal with 134 programs at the county level. So fragmentation and this challenge is pretty common across the board. I think my understanding is that in the cases you're describing, the way the programs are funded, either by donors or governments, it sort of doesn't allow for them to have this interest in sort of sharing resources, pooling resources, et cetera. Well, some countries have actually been able to, you know, try to bring that together. I don't think it's necessarily more effective to keep them separate. You're double investing in all of these processes and systems. So then the question is there a way institutionally? I think it sounds like the first question is institutional. How can you get either those donors or financing streams, whatever, to come together to help integrate? But then again, that's not so different, again, from the challenge here in Montgomery County, where they have all these different funding streams, all the way up to the federal government with Congress. These are all different ministries. Through the states, these are different, you know, entirely different lines, and then they have to make sense of it. So one way to do it is to try to make sense of it at the front office, front line. Could you possibly be collecting information in a common way, i.e. possibly through a integrated social registry? That's a very expensive process to go collect all the information. So if there are overlapping areas of coverage, et cetera, you might want to try to pool those systems. for that intake and registration. And then each program could determine their own eligibility off that common information. And that's the integrated social registry model, which a lot of countries from low to high income are using. I'm not sure if that answers it, but it's definitely a challenge across the board.
And if I can quickly add to that, I mean, there's definitely a value in that information flowing from programs to some to have an overview of who's receiving what, and having that integrated M&E overview. So and we've said that some countries have used that as a starting point to then kind of start to trigger some levels of coordination that can then bring to the creation potentially of a social registry if that's deemed necessary. So in terms of country pathways, that's definitely a potential pathway a country can take, and Kenya is an example of this.
Fantastic. Thank you both. Just two more questions because we are already over time, sadly. These questions relate to case management or, sort of merging case loads. The first one is, could you reflect on an example where case management functionality has been successfully integrated into a social registry or an integrated beneficiary registry? And secondarily, are there also examples, or is there a capability to merge social registries with humanitarian caseloads? The participant is particularly interested in examples relating to displaced people, and if you could reflect on both the political and the technical involved in such a merge. Thank you.
So this is Kathy. I'll just come in quickly, and then Valentina, feel free also. I just, again, always want to go back to that slide for the delivery chain. And that's pretty much my main message constantly. What is the function that we're talking about? Are we talking about the actual delivery of the benefit or the service, meaning the programs themselves? Or are we talking about eligibility determination, which could be done for a whole slew of programs, for a single, I don't want to use the word single, but for an integrated social registry system? So what is the phase on the delivery chain we're talking about? When you mention the case management functionality, we're talking about that far right purple part of the implementation cycle. And that is absolutely crucial to have a strong case management system. And some countries are trying to do those across programs. So they might have integrated case management so that you would have, that's slide 20, but it's the part of the purple part on the right. Some countries are working on integrated case management systems. I was in a meeting yesterday on a country in the Middle East where we were talking about that. As I mentioned, Montgomery County here in Maryland has this brand new electronic integrated case management system across 134 different programs, so the social workers can see not only who's receiving what, but what are the referrals, the intermediation, the family action plan, individual action plan, progress towards goals, notes on the counselor meetings, social worker meetings, etc. So that is sort of the far right-hand side, which is a bit different from the eligibility. The system links, and there are feedback loops and updates between those. One of the challenges that they mentioned here in Montgomery County is that social workers don't have access to didn't before have access to all the eligibility information, and now they can access all of the information as they do their case management. On the humanitarian side, again, I just want to always refer back to that delivery chain. Are you talking about trying to make sure that refugees or non-citizens can receive different kinds of programs? That will depend on the program eligibility conditions. Are you talking about, well, can the collection of data for the social registry be relevant and include refugees and non-citizens? And certainly several of these social registries do that. And then the question is, do you modify any of that eligibility criteria for that specific population group, as you might for other subpopulation groups? What are the ID requirements? What is the needs and conditions assessment, et cetera? So always there's this interaction between what is it that the program requires and then what is it in the system and function of how you collect the information. And that's what we've been focusing more on today. Valentina?
Yeah, so I'll answer really quickly on the case management. I mean, one of our case studies focuses on Turkey's integrated social assistance system and how that enables social assistance at local level to flag any issue that requires ad hoc case management, and for example, violence against a woman, and then that the system automatically creates a case and it reports it to the local foundation manager, who then redirects the case to relevant institutions, and then that information gets re-entered, synchronized into ESAS so that foundation officers can see what's been happening on that case. But as you say, it's about having the wider information system beyond the social registry actually focused on these functions, which are more on the right-hand side, as Kathy was saying. And there are countries that do that. On the linkage with development partners, this is not, I mean, I'm not focusing here in particular on IDPs, but just to give you, I mentioned before how WFP inputs data to Kenya's integrated beneficiary registry, the role in Mali played by development partners. And recently, another example is in Philippines, following Typhoon, where WFP and UNICEF were piggybacking on the Lista Hanan database in order to channel additional funding for people who'd been affected. They also did registration of additional caseload and additional households, and then those additional caseloads, people who weren't originally included in the List of Non-registry were included in the registry further down the line. So that there's quite a few countries where development partners have been playing a role, but it's very much about establishing long-term relationships, memorandums of understanding, and kind of very clear guidance as to how and what data should be shared and why and for what, and kind of avoiding all of the security implications that come from that.
Fantastic, Valentina. I'd love to keep going, but I'm very aware that we're already over time. But I just want to let all of the participants know that we've received a range of fantastic questions around all sorts of issues, from blockchain to data collection, to ontology methodology, which is a new one for me. And we will answer all of those in the written form over the coming weeks. So thank you all for coming along today, for listening to these two presentations, and for submitting these excellent questions. And we look forward to continuing to learn from the examples developing in your countries. Before we sign off, I'd just love to extend a wholehearted thank you to Valentina and Kathy today for really excellent presentations that quickly got us all up to speed on this work that they've been labouring over for many years now, and it's been a really under-researched area of activity, and so it's so fantastic that we now have these two excellent resources to help us guide our way through decision making. Okay, so without anything further, thank you so much and goodbye.
Thank you. Bye.
Bye. Thank you.
O organizador saiu da reunião. Esta conferência